Hey guys, welcome back to All and Law. This is a quick pediatrics, and today I'm going to talk about Hep A vaccination in children. Hep A vaccination in children, and briefly I'm going to talk about the adults also. Okay, so remember, hepatitis A vaccination is recommended for all children above 1 year of age. Okay, so before entering the school, the child should have at least what you call 4 doses of, like we see in a DPT. Okay, the fourth dose being at the fourth age. So we recommend hepatitis A vaccination above 1 year of age for everyone. Okay, 2 doses. We give 2 doses and 6 months apart. 6 months apart. Okay, right. So it's also recommended routinely for people with what you call a chronic liver disease, homosexual, okay, bisexual men, right, or any users illegal drug users. Okay, clotting factor disorders. Okay, and the people with what you call risk of occupational exposure, they can give routinely they can be given hep A vaccination. Okay guys, so let's talk in a tablet format that hep A post exposure prophylaxis. So if there's a post-exposure prophylaxis is really very important. Let's talk about the week since exposure is less than or equals to 2 weeks. Okay, and there are two possibilities, 2 weeks. Okay, this is week since exposure. Okay, if it's less than or equals to 2 weeks, future exposure likely is yes or no, depends. Let's take a no future exposure likely. Okay, and for all patients, whether its age is children or adult, all age group patients should receive prophylaxis of immunoglobulins. Okay, if they have what you call the future exposure likely, yes, they can have this exposure likely, and the age of the patient is what you call above 2 years of age, or equals to 2 years. Okay, then you have to give immunoglobulin along with hep A vaccination. Okay, hep A vaccination, right? So if the exposures, see, week since exposure is more than 2 weeks, okay, more than 2 weeks, then the post what you call a future exposure likely is not there. Okay, and all the patients of all age groups should not receive anything, nothing is required. Okay, and if the post exposure week since exposure is more than 2 weeks and likely he can have this exposure in future, then the age of the patient above or equals to 2 years, then should have only hep A vaccination. Okay guys, right? So why we don't recommend the vaccination for below 1 year, below 2 years, is because during 1 year of age he has received his all hep A vaccination, right? That's why. So this is regarding a brief discussion about the hep A post exposure prophylaxis. Thank you so much for watching this video. Take care.